Welcome to the exercise classroom, anatomical, biomechanical and practical exercise education. Today's lesson is hip joint adduction. Introduction. Hip joint adduction using the seated hip adductor machine is an isolation exercise that specifically targets the muscles of the inner thigh. It is performed while seated in a machine designed to provide adjustable resistance as the legs move inward against pads. This exercise is important for strengthening the hip adductors, which contribute to stability, balance, and control during lower body movements in sports and daily activities. Alternate names include seated machine hip adduction and inner thigh machine. Body contour benefits. Consistent training with this exercise can help develop toned and defined inner thighs, enhancing leg aesthetics. Stronger hip adductors can also contribute to improved lower body symmetry and balanced muscular appearance. The movement. Joint action. The primary joint action is hip adduction, moving the legs toward the midline of the body. This is important in activities that require lateral stability, such as sidestepping, skating, and changing directions in sports. Functional benefits. Strengthening the adductor muscles improves stability in side-to-side movements, supports better balance, and aids in athletic activities that involve quick changes of direction, such as skating, soccer, and tennis. It also assists in injury prevention by supporting the hips and knees during dynamic lower body activity. Exercise execution. Starting position. Sit on the adduction machine with your back against the pad and feet flat on the footrests. Position the thigh pads against the inside of your knees or lower thighs. Adjust the starting width so you feel a mild stretch without discomfort. Grip the handles for stability. Movement. Exhale as you bring your legs together smoothly, squeezing the pads inward under control. Keep your torso stable and avoid leaning forward or backward. Ending position. Inhale as you slowly return the pads to the starting position, maintaining control to avoid sudden release of tension. Proper technique. Maintain an upright posture and engage your core to prevent lower back strain. Range of motion. Use a range that allows full control without forcing the legs into an uncomfortable stretch at the start. Common mistakes. Avoid leaning forward, using momentum, or releasing the pads abruptly. Do not set the starting position so wide that it causes hip or groin discomfort. Muscle mechanics. The movement begins with the adductor muscles lengthened and under tension. As the legs move inward, the adductors contract concentrically to bring the thighs together. The return phase involves eccentric contraction to control the outward motion. Primary movers. Adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus. These muscles are located on the inner thigh and are responsible for drawing the legs toward the midline. Other muscle roles. Antagonist, gluteus medius and minimus act as antagonists, opposing the inward motion by abducting the hip. Synergists. No significant synergist muscles are heavily involved, as this is an isolated movement for the adductors. Stabilizers. Core muscles and gluteus maximus help maintain pelvic stability throughout the motion. Biomechanical considerations. Hip adduction occurs mainly in the frontal plane, so maintaining control is essential to prevent momentum from reducing muscle activation. Keep the pelvis stable to avoid compensatory movement from the hips or spine, ensuring the adductors are fully engaged. The further apart the legs start, the greater the resistance torque at the hip joint, increasing adductor demand. Beginning in a slightly stretched position optimizes force output without overstretching the adductors. Training effectiveness and optimization. Controlled eccentric phase. Slow the return to the starting position to maximize muscle engagement and time under tension. Mind-muscle connection. Focus on contracting the inner thigh muscles throughout the range for better activation. Adjustable range of motion. Set the starting position to a comfortable yet challenging stretch to target the adductors effectively. Breathing strategy. Exhale during the adduction phase to maintain core stability and maximize force output. Safety and injury prevention. Avoid overstretching. Excessive initial stretch can strain the adductor muscles and groin area. Pelvic alignment. Keep the pelvis and lower back in contact with the seat to prevent undue spinal stress. Gradual load increase. Progressively add resistance to allow the adductors to adapt and prevent injury. Warm-up requirement. Incorporate dynamic hip mobility drills before performing heavy sets to reduce injury risk. Variations and alternatives. Band hip adduction. Uses elastic resistance to target the hip adductors, allowing for variable tension and portable training without the need for large equipment. Multi-hip adduction machine. Stable, guided resistance to focus on adductor activation without balance demands. Standing cable hip adduction. Enables dynamic resistance and varied angles of pull for adductor emphasis. Mastering the seated hip adduction machine strengthens the inner thigh muscles, improves hip stability, and supports better performance in sports and daily movements.